Yeah, so welcome, Melissa. I'm so
Thank you.
excited
Thank
to
you.
share with everyone about the upcoming Somatic Concentric Sex Therapy training that
Hmm.
is coming up in Chicago in April in 2023.
Hmm.
And we are open for people to sign up on the website, which will be
Hmm.
below. But what we wanted to do was have a little conversation that talks about what to expect, um, what resources practically therapists are going to be gaining from the experience, and also just so people can get a sense of you and
Hmm.
how wonderful you are, and how you facilitate embodied experience in a way that is non-threatening and also wondrous. That's one of the things that struck me from our conversation, from our interview, was
Yeah.
this continual coming to the magnificence
Yeah.
of the body and of this work that you're doing that is so deep and on these fringes of established fields that have
Hmm.
been yet unintegrated fully.
Yeah.
So, welcome.
Thank you. Thanks for having me. Thanks for having this conversation with me. I think it's important because, as you found when you released our interview, people see the words sex and sexuality, and there's often a retractive kind of experience that happens for people, especially for therapists, when we start to talk about the importance of being inclusive of clients' sexuality when they're in the room with us. There's a retraction that can happen for a lot of people. And sexuality is so integrative into who we are as individuals, into how we inhabit our bodies, how we relate with the important people in our lives, um, how we relate to pleasure and self-care. I mean, it just how we relate to our gender, our experience, and our expression of our gender. I mean, it's sexuality infuses so many different areas of our lives, and yet a lot of fear comes up because of the cultural taboos and just general cultural constrictiveness around sexuality. But then also, the vast majority of counselors have not been trained in any kind of sexuality, sex therapy, sex research, anything like that. Um, like you were saying, it's on the fringes of so many specific counseling fields. And if it's not included in the program, then it gets kept as other. And so the training that I offer and have been offering for just over 7 years now, it's changed over the years. It's gotten more extensive, it's gotten deeper, it's gotten more refined over the years. And it's you know my hope that I can create spaces for counselors and psychologists, and I've had coaches and massage therapists in my training previously, to provide a learning and an educational space where they feel comfortable enough to push their edges and learn about sexuality and how you work with a client's sexuality within our ethical parameters in the therapeutic space. Um, yeah, so that's been my mission, is to find ways to incorporate it.
Yeah, it's very exciting. And anyone who has not listened to our interview, I encourage people to go back and have a listen because we talk a lot about the context of how you arrived at the creation of this course,
Yeah.
as well as some of the theoretical underpinnings that you have.
Hmm.
But I thought that maybe we could start today by talking about the name that you gave this program, this series of classes,
Yeah.
It's somatic concentric sex therapy. And perhaps you could break it down for us so that we can have a sense of what to expect from each of those parts.
Hmm. Yeah. Yeah, absolutely. That feels like a good place to start. So, originally it was concentric sex therapy. That was as I was putting together my program, my training program for probably the fifth or so time, or the fifth year that I was putting it together. I started writing out the maps in such a way that it started to look like concentric circles. Because the program itself goes through an arc of internal, so the internal somatosensory experience of being in a body, to how we interface between that internal somatosensory, so somatic and sensory experience of the body, how we interface between internal and the world that's around us, and then our relationships. And then there's our experiences and influences from the broader culture around us. So it's fundamentally a model that looks at our embedded nature and how that influences and how we influence the environment that we are in as we grow and develop, form relationships, things like that. So originally it was concentric sex therapy. But then I realized a lot of people didn't know what that meant. And I wanted to make it a little more clear in terms of being specific about it being a somatic or body-based model. And so then I put the somatic at the front. So it's somatic, meaning body, and the model goes beyond just like a lot of somatic work is focusing exercises. So focusing internally, being mindful of sensations in the body, emotions, feeling our emotions, feeling that sort of thing. But this model, as it's related to dance therapy and specifically about sexuality, I'm looking at the sensations that are happening in the body, and as well as the movement that's happening in the body, and how the internal experience is expressed externally. So it's that interweave between internal and external. So it's how we hold our bodies, it's how we move through space, it's about how much space we take up or how little space we take up. And then how our bodies relate to other bodies, in our intimate partnerships, how our bodies organize in relationship to a partner. So we're looking at how our behavioral habits and our beliefs and our thoughts and things like that have somatic architecture. And we're looking at what is the somatic architecture, and then how do we actually invite that architecture as both a resource and a tool for growth and change and evolution. So the somatic and then the concentric is our embedded nature that influences how our somatic architecture takes place. And then sex therapy, because we're talking about sexuality. So we're talking about sex, which is, sexual intimacy with ourselves and with other people. We're talking about the sexual and how we relate with, sexual things within our spaces, or messages that we get from the media about what sex is supposed to be or how our bodies are supposed to look or things like that. And then sexuality, which is more of that creative, generative energy that's present in our bodies all the time, that gives life to how we interact in the world, even in non-sexual ways. Because that's the realm of what we reach for because it's interesting, what we reach for because we have curiosity, or we want to experience pleasure, like we see if we really love chocolate or something like that, and we see the chocolate and our body lights up and we go to reach for the chocolate, how do I relate with my body and my desire as I reach for that chocolate? And because of cultural and social influences, that gets quite complex.
Mm.
And so the concentric map allows us to look at that somatic architecture, the somatosensory experience of the body, the expression of that, and then how relationships and family and culture and religion and media and all these forces impact how we embody ourselves.
Yes, this is so beautiful. Like you've created sort of an arc with all these interweaving pieces because you started talking about the individual and
Mhm.
the somatic and the sensory, and
Mhm.
then you expanded it out to the relational and then to the broader culture. So there's that series, and then even in talking about our embeddedness
Yes.
and our sexuality, it struck me as you said sexuality, that's kind of in that more center circle, like it's the place of
Mhm.
the erotic. And I'm curious how you see the connection between those two words, like
Yeah.
the erotic and the sexuality being like a generative energy, an energy of desire, of activation,
Yeah.
of moving towards.
Yes.
And also, and then from there, going from sexuality to the sexual, which has that cultural
Mhm.
layer that impacts what structures are allowed to be created. And
Yeah.
then sex, as in the actual acts,
Mhm.
ways in which sex can happen,
Yeah.
which tends to be so limited within culture. And
What's appropriate, what's not
yeah,
appropriate.
even what it looks like, right?
Yes.
Like how many of us learned about sex from watching something that was recorded by someone who's trying to sell you something,
Yes.
sell you perfection or sell you um,
Yes.
an orgasm.
Yes. Yes.
As opposed to the process of coming to understand sex as something that is connected to
Yeah.
relationship or to relationship with oneself, that
Yes.
tuning into desire, and then
Mhm.
with others connected to that consent of what feels good, the curiosity instead of
Yeah.
um, the objectifying, I guess, of the
Yes.
sex. Um,
It's that unraveling or uncoupling consumerism from what is true and what's really well in our sexuality. And consumerism pulls us into a certain direction that may or may not be true, or um, express a sense of wellness for us. Yeah.
Yes, and the controls that exist within consumer culture,
Yeah.
the gatekeeping of it, of what
Yeah.
it's going to look like,
Yep. Absolutely.
um, and his history as well. You're
Mhm.
also talking about this as something that is contextualized within, um, for us, American culture, and so
Mhm.
there's also um, a lot of systems in place
Mhm.
that have pushed um, sex into kind of a shadow place.
Mhm. Yeah.
Um,
Absolutely. And as a part of the training, we do something called erotic mapping, and we look at the erotic map of the individual. So, a minute ago, you asked what is the difference between sexuality and the erotic? And sexuality is about creative potential. It's creative potential energy that exists within us. The erotic is specific. So the erotic is what is specifically interesting to us, or that we find that we're interested in based on how our somatic architecture has been formed through our experiences during our development and through our adult relationships. So when we look at the erotic, that's the sort of thing that really pulls on us, because that's the edge where our curiosity can send us into a place of growth and evolution. So when I do the erotic mapping, I look at where people are resourced in their sexuality, where they're embodied with a sense of ease and excitement. We look at where people are challenged in their sexuality. That's the growing edge. And then we look at what's in the shadow. And there's a process that I go through where the shadow just starts to show up. We don't have to search very long for it, because it's just there. I mean, like you were saying, the culture, our, culture and the beliefs that become oppressive on how we inhabit ourselves are ever present. And so as soon as we start talking about sexuality, as soon as we start talking about intimate relationships, arousal anatomy, things like that, the shadow presents itself. So we dive pretty deep into the erotic mapping process. And the whole training program has a foundation of embodied consent, because there's so many things that we are inundated by that we don't consent to have inundating us,
Absolutely.
experiences that we have as young people, where all of a sudden we're faced with sexual information that's not appropriate for us, that we're too young, to be able to understand or digest, or, so this program is all about embodied consent. And so as we're going through and talking about these different pieces, I'm inviting people to notice, where is their yes and where is their no in their body? What are they saying no to in the moment? Because that's their growing edge. There's something that they need to work with in order to invite that no to release without force, but to invite it. And to invite it not to be permissive in terms of sexuality, but to come back in line with what's true for them. And what is it they want to say yes to? Where's their yes? So that's an integral part of the program. And I offer a lot of experientials around embodied consent, and then also guidance around how to teach clients about embodied consent.
Yes. So the way that you teach this is by working with the therapist in their own knowledge of these areas of the remind me again, it's the where they feel, did you say mastery or ease?
Yeah, a place of resource or full body effort.
So that's a place where there's ease, and then there's the challenge, and then there's the shadow.
Yes.
And so for a lot of therapists, I imagine that part of the reason sex therapy is something that they're not comfortable with, first of all, because most programs neglect to teach it. And there are not very many resources out there for people to learn about it, especially from a somatic and embodied place like you're talking about. But the majority of the education that I received about sexuality was framed within the context of trauma.
Right. Yep.
And so for that reason, I think, I'm not speaking for all therapists, but when we started to have this conversation, it was kind of pushing some of my edges to, in a way that felt really hopeful and joyful to me, because I do believe that our sexuality is something good.
Yes.
And it becomes a part that we're afraid of
Yeah.
within ourselves. And then we're also afraid of going there with clients because many of our clients are coming with deep wounds, and it
Yes.
is terrifying to go into this space.
Yeah.
So could you speak a little bit to that, the those who potentially have had some kind of those therapists who are working with someone or specialize in working with people who have um, sexual violation or trauma,
Yes.
and how this work that you're offering can
Hmm.
really help their
Hmm.
clients.
Yeah. Um, and you're right. That was also my experience going through my own graduate program, was that sexuality was framed in terms of something that happens during development, like in my human development class. Sexuality happens. And then we talked about it through the lens of trauma and working with trauma. Um, but what you're talking about, that sexuality can be joyful and life-giving. There was none of that. There was none of that. And so when we're working with someone who has experienced trauma, specifically trauma from violation of their body in some way, um, there's a hope that the therapist gets to hold beyond doing the trauma work. Doing the trauma work to say, let's, here's what happened, and let's get your um, body autonomy back and your ability to regulate your nervous system response and repattern how your nervous system responds to activating things that happen. And then we take that body autonomy into relationship with pleasure that's self-directed. So then we get to learn about, well, how does this person engage with their own sexuality in a healthy way that's in line with their development? So beginning very simply with what feels good, non-sexual things that feel good, non-sexual places where they feel that they can really express their bodies. And then from there, they take that body autonomy practice and awareness and that embodied consent practice, respecting their own bodies, respecting the body and consent of others. And they go forward with curiosity to explore what feels good to them, what is life-giving to them, so that they can really start to take up space again and have agency in their, intimate relationships, and in their own bodies. And what that does is it takes the healing to a whole other level, you know. Also in the case of, uh, like medical trauma, people who have experienced medical trauma, surgeries, cancer, things like that. There's rehabilitation that we do with our bodies that's pretty basic, and they tell you to go at a certain pace and do these exercises and take the time to heal and eat this kind of a diet and that sort of thing. But it's also about inviting pleasure to inform how our bodies heal, because pleasure invites expansion as opposed to contraction that happens when we're in pain or we're uncomfortable or we're afraid. So when we're able to actually embody relationship with pleasure, that's what allows us, our bodies, to actually expand back into the world again. So it's bringing in that hope that people who have experienced trauma, little by little, can begin to express that generative, life-giving energy in their lives again. And it's really powerful work. It's not like, pleasure is not frivolous. Pleasure is vital to fully inhabiting our bodies. And to do that, honoring our bodies, honoring the bodies of others with embodied consent, just creates such a beautiful opportunity for evolution. and ultimately to help heal the social culture around sexuality.
And so this course is not necessarily for someone who is looking to become a sex therapist. It could be. There's a whole track
Yeah.
where a 15 credit hour course would be very useful if you want to become a sex therapist.
Yes.
But how do you see this course supporting therapists in their own um, confidence
Yeah.
in holding space for these kind
Mm-hmm.
of questions with their clients?
Mm-hmm.
And also, how do you see it as connected to competence,
Mm-hmm. Yeah, absolutely.
multicultural competence?
Yes. So that was, I think, 3 questions. So first question, I'll ask you to repeat one of them probably. So first question, how is this supportive of people who want to be on the sex therapist track, and for those who don't want to be on the sex therapist track? So if you want to be on the sex therapist track, this my training program is super helpful because it helps you understand how to bring somatic work and the whole body, so body and mind, in a super integrated way as you go through the rest of your sex therapy courses, because the vast majority of sex therapy is cognitive and behavioral based. There are a couple of people who are offering more somatic perspectives. A lot of that is body psychotherapy and Gestalt based. And so my training program is body psychotherapy and dance movement therapy based. So it's quite different. So as I've gone through my training program, I just became an ASECT certified sex therapist. Very excited about that. It took me a while. That whenever I was in these other classes for my sex therapy certification, I had to do my own work of bringing in the body and movement and expression, because the vast majority of the programs that I took did not do that. They talk about the body in a more functional way. And so this training program is quite different and will give a foundation for people to actually take into their other training programs to learn other things from a somatic perspective, even when somatic is not being presented, which is quite likely. If you don't want to be a sex therapist, the program allows you to get sort of an overview of what sexuality is, so that you have a broader understanding of it and it doesn't feel so murky and confusing. It offers you an opportunity to look at your own beliefs and experiences and biases, and how that lines up with sort of a broader view of sexuality and how that shows up for people. And then ethically, because so much of sexuality is in the shadow because of all the cultural taboos and conditioning and oppression and things like that, when our client is maybe having a sexual issue or something related to sexuality or related to their body or related to their gender, it is very easy for us to project onto them what we think sex is, what we think gender should look like, what we think is appropriate for bodies, this sort of thing. And so the program allows people a space to take a look at what might I be projecting onto my clients, and how can I be more inclusive? How can I look at sexuality through a broader lens where I'm not afraid of the topic anymore, so that when it does come up, I can have a bit of a conversation. And then if it feels like it's outside of my scope of expertise, I can refer to someone else. There's a module in the training program where I talk about ethics of doing somatic psychotherapy, dance therapy in the realm of sex therapy. Because as sex therapists, there are, there's the mandate of, um, appropriate behavior with a client. And so we talk about how can you actually talk about sexuality and arousal anatomy and things like that and stay within our ethical guidelines. That also allows the client to be in their bodies and express and move and actually be able to access that somatic creative process to create some change. And then, talking about what homework can we give them to take out into their lives to keep that rewiring process going. Did I get all your questions? Was there one that I missed?
I think the last one that I had was, how is this related to multicultural competence?
Yes. So that's another piece of, we have as a culture a lot of ideals about how sexuality is supposed to be expressed. And so this is where we get to pull apart the influence of basically white Puritan culture, the influence that has had on our sexuality and how we embody ourselves, how we participate in relationship, the structure of our relationship, things like that. So we get to pull that apart. What is the white colonial Puritan more perspective, and how has that influenced us? What other influences have we had? Because the culture treats people differently in their sexuality expression based on their gender, based on their body size, based on the color of their skin, based on all these different factors. And when we look at that concentric experience of being embedded within a culture, then we get to pull apart how have I been influenced specifically based on my social location, and be able to evaluate my client that's sitting in front of me. How have they specifically been impacted in their sexuality based on their social location? Because that's where a lot of that oppression, that oppressive experience gets rooted in us, is our interaction with these different cultural structures. So we'll get to take a look at that as well.
Yes. And you said that most of the sex therapy training is focused on cognitive practices. And what you're really bringing is dance in some way, movement. Can you give us a sense of what that might look in the educational process so people can be a little bit prepared? Sometimes in a therapy session, I find that when I say the word dance, just like when we say the word sex, there's all these webs of assumptions about what that means. And so I'd like to hear how you embed the process of learning that embodied consent into the movement process itself.
Yeah, absolutely. That's a huge question, Kim. Here we go. Here goes my best attempt at this. So sex therapy is largely cognitive and behavioral based. And it comes from the medical field, right? A lot of our main theories in sex therapy come from the medical field, behavioral field, and then the cognitive CBT field. And that's great because it helps us take a look at, well, what actually happens in the body during arousal, for example, right? And there are people who studied that. What is actually happening in the body during arousal? We don't know. We had a lot of incorrect assumptions about body parts and what happens in the body, and what does it mean if one person is turned on and the other one is not? What is supposed to happen? And then you have the social lens that goes on top of that, right? So that's where all the sexual schemas come in, the ideas and the cognitive structures and understanding that we have about sex and sexual relationships and appropriate behaviors and, that sort of thing. So being able to deconstruct that has been such a gift of sex therapy. When we incorporate the whole body, we become aware of a sexual schema, and then we get to see the somatic architecture of that schema in the body. So because I believe this, or we'll just start with that. Because I believe this idea about sex, I inhabit my body in this particular way in this situation. Right?
Mhm.
And so we're looking at how is the body expressing that belief? Because I have a lot of, and this is where it gets tricky, because I have a lot of people who come in here and they say, I want to have a good sexual relationship with my partner. I believe that I have the right to have a good sexual relationship with my partner. And my body is not responding the way I hope, or the way it should, or whatever. So why is that arousal non-concordance present? This person has taken their sexual schemas and said, I don't believe in that archaic stuff anymore. I believe that I have a right to experience pleasure and this sort of thing. And yet their body is still acting as if those other things are true. The archaic stuff is true. So when we actually allow the body to speak to us and really inhabit our body and begin to express the movement qualities, and this is where the dance piece comes in, because we're constantly moving and we're constantly expressing our internal beliefs and our internal thoughts and understandings and misunderstandings. And so that's where we can repattern stuff in real time. So for example, if I have a couple in my office, because I primarily work with couples. If I have a couple in my office and one of them is saying, I want to have a good relationship. I want to have a good sexual relationship, but they're like this while they're talking. There's something incongruent that's happening. And if I'm only going off of what this person says, I'm not getting the full information. And we're missing the opportunity to invite the body in as a resource, as well as a way of helping to understand why the incongruence is present. So when I invite the person to notice what's happening in your body, how is your body moving? How is your body relating to the body of your partner in this moment? What is your body actually saying, even though your words are saying this? Then I get the, people really wake up in that moment. And then I invite them to follow the movement impulses of their bodies to say, well, what's actually wanting to happen here as you talk to your partner about your sexual relationship? And then I get them moving through the space. So we actually create choreographies, and not like dance choreography that you would see in a dance performance, but a choreography of here's what my body is experiencing. What does my body need to feel safe enough for my body to have that relationship with embodied consent, to actually want to open up towards my partner? So then that's the choreography that we develop of how do you go from restricted into open and connected and expressive in a way that honors embodied consent, and that honors what is true for that person, what is actually wanted, as well as honoring the desires and the boundaries and the respect for the body of your partner, right? And so the dance part comes in terms of inviting the body to express externally what we feel internally. And that's where that process of change really is effective. And that's what's missing from most of the sex therapy trainings that are out there that I'm trying to change.
Yes,
Yeah.
absolutely. Beautiful. Thank you so much. I feel this is really rich. I know there were some other questions that we we're talking about exploring, but I feel like we've captured a lot of the essence of the training, the benefits of it. Is there anything else that you would like to share with potential students?
Yeah, that we are going to be doing some theory. I'll be presenting some theory and some maps, and throughout the training program, wherever possible, I invite experiential practice. So there will be practices that you do with yourself. There will be practices that you do in a dyad with another participant. And then there will be experiences that we do with the whole group as well. So I would say at least 1/3, if not more, of the program, the training program itself is experiential. You'll be moving, you'll be turning your attention inward, you'll be oscillating your attention outward to notice what's happening in the group, things like that. Because I really want to give people an embodied sense of the material. And I want people to be able to have some moments of actually practicing with someone else. Elements of the model that are interesting to them, that feel, usable. And, I often hear from people when I get feedback from the training programs that I do, is that people leave here with skills that they're applying right away. And then they're sending me emails about, this is what happened with the client when I did this mapping process and we did the somatic component of it, and they want more information, and then I do, consulting sessions with people to help them deepen it. But my hope is that people leave the program being able to use something right away or incorporate it into their own style, because that's the other thing, is I want people to incorporate things in a way that feel true to them, so that they can express it in a way that comes across authentically for them. So it's a highly experiential program.
Wonderful.
Yeah.
I'll be there.
Yes, I know. I'm so excited.
Yay. Thank you so much, Melissa.
Yeah, thank you. Thanks for having this conversation with me today. I hope that this is helpful for people to kind of soften any fear that they have around this topic, and recognize how useful this is for counselors, even if they're not going to be a sex therapist, but to be able to have more ease and a common language to move through these things with clients when sexuality presents itself in the room.
Absolutely.
Mm-hmm.
Thank you.
Mm-hmm. Thank you.